Hi, I'm here today with Pam Smith, Project Coordinator for the Kenosha Lifecourse Initiative for Healthy Families, to tell us a little bit about that project and what it's up to. Pam,
Wonderful,
tell us more.
wonderful. Well, first thing I'll do for you is throw an acronym out there so you won't have to say that mouthful, nor will I. So the Life Course Initiative for Healthy Families is better known as LIFE, pronounced LIFE, but also known as K-Life, Kenosha Life. And the reason for that is that the LIFE project is a statewide initiative that initially started in Milwaukee, Racine, Kenosha, and Beloit. And Beloit is no longer a part of the initiative, but the other two communities are included. So K-Life, R-Life, M-Life for Kenosha, Racine, Milwaukee. And here in Kenosha, we, as in the other communities, began back in 2010 with funding from the Wisconsin Partnership Program. And that emerged as a spike in African American infant mortality was observed in the southeast part of the state. Reasons for that is also that 85–90% of African American babies that are born in the state of Wisconsin are born in the southeast communities, and that is also where the disparities in infant mortality and the ratio between the black-white infant mortality rates were most highly observed. So each community had the opportunity to do a needs assessment plan, create a community action plan tailored to its own community and priorities that were identified. And here in Kenosha, we identified prenatal care and home visiting as interventions that would help engage moms and increase prenatal care awareness and some of the other health behaviors and indicators that would improve infant mortality. Also engaging fathers and the Fatherhood Initiative, which is now also in full bloom and funding with the Racine Kenosha Community Action Agency through the WIC program, the WIC Dedicated Dads program. And in addition to that, we received separate funding for life grants that have since concluded, but we had three separately funded interventions under the LIFE program. So primarily because we don't do direct services, the initiative was funded to increase the engagement around local resources, community partners, community agencies that are serving maternal child health programs, as well as engaging the family and fathers in those services. So we saw improvements in the infant mortality rate up until a couple of years ago when we unfortunately lost, I think it was 4 babies within a 2-month period of time. And our numbers in Kenosha compared to the other communities have always been relatively low. And so a spike like that would considerably elevate our rate, and so the infant mortality rate is still double digits compared to around a rate of 5 or 6% for the average. The collaborative has had some transitions as new priorities emerge in the community. We've seen some of our members shift and participate in some of the other coalitions that are emerging, and yet we still have a core group of 15 to 20 people that have been meeting since 2010. Funding is scheduled to sunset March 31st of 2019, although there is potential for another 5-year funding cycle by the Wisconsin Partnership Program, although things will look a little different. I think rather than specifically targeting infant mortality, it will encompass health equity and some of the social determinants of health that, in addition to prenatal and some of the medical care, prematurity, low birth weight issues, we'll look at some of the socioeconomic issues, housing and other support services, nutrition, and the other services that also impact infant mortality.
We understand that the program will be making a transition as you make a transition here in the coming weeks.
Oh, how could I forget? 2 weeks left before retirement, and Atifa Robinson, who came to us from Kafasi and had been a part of our collaborative early on, will be my successor. I've had the privilege and benefit of onboarding her and working with her since May 21st, I believe it was. So both of us have been employed as we transition for that succession training and orientation. But I'm hoping that the community and the collaborative will be as good and supportive of Atifa and Leanne Blanc, who's our new population health manager, and the Division of Health and all of our community partners, key of which is Racing Kenosha Community Action Agency, WIC, Prevention Services Network, the Community Health Center are our kind of cornerstone agencies that have been at the core of this effort from the beginning. But yes, I'm looking forward to retirement and 1 year before my granddaughter's off to college and I'll have the house to myself.
Excellent. Thank you very much.
Thank you, Joe.